All right, guys, I'm back. So, hold on, let me take some water real quick. As promised, I was going to talk to you guys about my CMS today, which is the ATI exam. It's a nursing exam. And let me say this, okay? So I'm in maternal child. That's my specialty course I'm in right now. And for us, it's mother baby. That's what I love to call it. But anyways, the CMS test was 70 questions for 70 minutes. So, of course, we have 70 minutes. But you didn't need the whole 70 minutes because, of course, some of the questions were like relatively easy. So you're able to get through it and in a reasonable amount of time anyway. So it took me about a good maybe 53 minutes to finish 70 questions, which is kind of good because I was really bored after probably about the fifth question. And on top of that, like, some of the questions just be so blah, and the test was so long. And then, my stomach was hurting, and then had like severe back pain, Other than that, I guess it pretty much has a lot to do with how I sleep, because the way my pattern works is really difficult to sleep because I work Friday, Saturday, Sunday, Monday. I have class Tuesday, Thursday. Wednesdays, I pretty much have study group, or I do most of my studying on Wednesdays. So what day do I have to really sleep? So that's where a lot of the stress and tension and back pain kind of stems from. But anyways, let me get back on subject. So it was 70 questions in 70 minutes. And the thing about it is I was really disappointed in myself because I only got a 70. So let me explain how this goes. You get like a level 1, a level 2, or a level 3. So like a level 3 is like the best level. That's where you want to be. Most people say that's where like people cheat, but I don't even know how the heck you cheat. But anyways, so level 3 is like a 80 to 100% or something like that. Level 2 is what I got, which is I got a 70. So I think it's like, I don't know, I want to say like 60 something to like, I don't know, 79, because 80, yeah, about 79 or something like that. And that's a level 2. So that's what I got. And like today, one of my classmates was like, well, that's where they want to see you, pretty much is in level 2, because that's where you should be right now since you have a year left or whatever. So they expect you to at least get a level 2 on the CMS exams. So I didn't feel really bad, but I'm like, level 2, I got a 70. So my whole main thing is like, I don't want to kill anybody. But anyways, and a level 1 is like, I don't know what it's like to, I think it's like something to like a 60 or something like that, 69-ish. No, it's not 69. It's like below, it's in the 60 range. I can't really remember the scores or whatever. I probably should have had that stuff, but it was like a 60 something or whatever. And then that's where, level 2 is where everyone was trying to get, but pretty much wanted to do a level 3 because you have to do remediations for your CMS exams, which means like you have to do some basic concepts. You have to do a whole bunch of little basic stuff for it, like do critical points to make sure that you remember for upcoming tests, or you remember when your NCLEX come around that you remember these things or whatever. So they try to get your mindset to where you understand, so where you won't forget. So it becomes like repetition for you, which is good. But sometimes my hand kind of hurts from all that writing. But I'll probably get started on that tonight. But another reason why I was mad, because I didn't really study a lot because I worked all weekend. Like I said, I had to work Friday, Saturday, Sunday, and Monday. And I worked all those days by myself. I was the only nurse there working with the provider. So sometimes that's a little stressful because I can't get my work done. I can't study. Most of the time I can because there's someone else there. But on the days that I have now, which are like the weekends pretty much, it's just me. So on my Mondays, I normally have somebody that works with me. So it's not as busy. You would think because it's a Monday that it would be, but it's not as busy. So I have time to focus a little bit, study, do my homework. I do that a lot. My ATI assignments, I do that a lot too. And Fridays are normally not that busy, so I'm really able to get a lot of my work done. But this past Friday, crazy. I felt like everybody in Georgia was sick. Or, people started calling their friends, telling their friends to come by. I don't know what the situation was, but Friday was really busy, so I didn't have a lot of time to study either. I had another exam on Thursday, so that prior to Thursday, I was studying for that exam. So that only left the weekend, Tuesday, Wednesday, for me to get prepped for this, for today's exam. So I used a lot of different references and things that I like to study from. So I listened to like Kathy Park's videos. I ran it through a lot. I think it's maybe like for the CMS, I think she has like maybe 15 videos or so. I went through those 15 videos multiple times, like, all right, let me go through a little bit. Let me make sure that I get it, make sure I understand it. So if I hear something like this or I see one of these on the exam, I'm like, bet, I know I can go through this. I can see it and I can understand it. And there we go. So that was one good tool that I used. Another one was the RN Mentor, the app. I have that app. So what they tell you to do is answer at least like 25 questions a day. I nailed 25 questions a day. I'm like continuous with it. Now I've gotten to the point where I can probably, it just depends on what day it is, I probably could do about 50 questions a day. And that's only because sometimes doing those questions, I get really bored. Yeah, I know that's sad, but sometimes I just get really bored and I'm like, okay, I'm tired of answering these questions. So I put it down and then I kind of go back to it a little later to try to make it to the 50 questions. But it's a difficult process of just sitting there answering questions. I mean, who really wants to do that on a daily basis? But I know as nurses, like you got to do the questions because that's all in the plan, the routine, all in the recipe for success. So totally get it. I'm sold out to it, but actually doing it is something totally different. So I did that. That was another reference I used. I didn't do like Quizlet, stuff like that. I just really, sometimes I don't trust that. A lot of times I don't trust that information. So I just rather like look through the books that I have and things like that. So I went to our library, not our library, but we have a CAS building. So I went there and kind of got the book. Those books have gotten to be really expensive. And since I am paying out of pocket for my tuition now, I really don't want to spend the money on the books. I honestly don't really have it. But I don't really want to spend the money on the books because they're a little pricey. So since this CAS building has the books, I just go in there and I kind of peruse through, kind of like take a few notes and things like that. So I did that too. Definitely pulled out my notes from class. My professor is awesome. Like, I truly love this class. I love this class. This class was complete confirmation that I wanted to be a labor and delivery nurse. Like, I love this class. From her talking and explaining everything to me to my clinicals. Man. So I have clinicals at Piedmont, Atlanta. And when I tell you that, first of all, I'm absolutely sold out to Piedmont. I'm sold out to like just taking care of people all the way around, but just sold out to Piedmont. So anyways, we we have 3 departments that we go to for the maternal child mother baby rotation. So we went to like the NICU, which I did not do at all, and I really gave up my NICU day to somebody else. It's not that I don't like kids, because I absolutely love kids. I adore kids. I do. But I guess seeing sick babies and they being so small, and I don't know, it just really wasn't something where I was like, I just want to go in there and do it. No, not for me. And I guess everyone has those things where they're like, yeah, this is for me, this is not for me. So, yeah, being in there just wasn't for me. So I gave up my day to somebody else. Also, you have like of course, the postpartum mother baby area. So I did that day, and when I tell you, I absolutely learned so much. I had an amazing nurse, awesome, that showed me how to do a lot of different things, and she was really knowledgeable, which was really good, because sometimes you don't get paired with someone that knows a lot. Or they always have to say, okay, let me ask somebody else or something like this. So she really knew a lot. And I mean, I learned how to do so many different things from, so many different things that you see in a book and you actually learn how to do it. Like I learned how to do a PKU, CCHD. I did all the newborn exams, from head to toe exams. I was able to do all the assessments on the moms, on the postpartum care and stuff, explain to them about breastfeeding. Of course, the lactation nurse came in, but I was able to answer some of their questions that they had. And if I didn't know the answer to it, the nurse I was with, she jumped right in and pretty much answered it, because she knew all the answers to everything. So I'm trying to get to her level, for real, for real. But it was just an amazing all-around experience for that, and taking care of not only the mom, but also taking care of the baby, and learning different things with the temperature and phototherapy, and learning about the bilirubin and doing those different things, and watching them do circumcisions. It was just a lot of information and learning experiences, it was a lot, and it was overwhelming, but it was like, I felt so much joy. It was a lot, but we held it down. And then I had labor and delivery. So I had labor and delivery twice, because I told you guys I gave up my NICU day to do labor and delivery. So the first day I had labor and delivery, I watched the vaginal delivery. Amazing. The absolutely most amazing thing I've ever seen in my life. Now, of course, I've had kids, so I've been on that opposite end. And seeing, childbirth videos and things like that, on TV, YouTube probably, I don't know. I've seen some stuff, probably Facebook, I have no idea what it's been. But to absolutely, physically be in that room and be that nurse that, telling a patient, all right, you got this, just breathe through it, explain to them when to push, things like that. Of course, I didn't get to do all that this time. I was being 100% supportive. Yes, I was saying, all right, you got this, those type of things. But of course, the nurse I was working with was pretty much instructing her when to breathe, when to push, and things like that. But being in there, that doctor was amazing. She thoroughly explained everything to me. She was just kind and just, hey, Maria, come over here, see this, and this is why I'm doing this. And just to watch her movements, of course, it seemed like she's been doing this for years and have done a lot of deliveries, but everything was so calm with her. It wasn't like a lot of distress going on, or she wasn't stressed out. Everything was just so positive. Everything in the room felt positive, It was like her conversation with the dad, hey, come over here and hold her leg, and, we're going to get your baby out. And it was really sweet. And just where she put me at was a good spot for me to see everything. So just actually being able to witness that whole situation, I was like, yeah, This is my confirmation right here. I definitely, truly want to be a labor and delivery nurse. Got to be a labor and delivery nurse. That's just my heart. I know I'm there. I know I could be that positive person that will be in that room with that patient and have a successful delivery, or definitely hope that every single delivery I have is successful. But they always tell you about the ones that's not and what can go wrong and complications and all that good stuff. But yeah, so then that last day I had labor and delivery again. I saw a C-section. Oh my God. I just, who would have thought? That was the most amazing yet heartbreaking. I don't know, it was a lot of emotion with that because she was so exhausted that the doctor was talking to her after the baby was born or whatever, like, hey, here's your baby. She was just like, okay, all right. And I know she didn't like push or anything, but she was just exhausted. It was almost like she was over it. And then the baby was huge. The baby was like 8 pounds, 14 ounces. And she was just like, all right, hey, baby. It was their second baby, so it wasn't their first one. But still, it's like her whole demeanor and everything was like, look, I'm tired. So I watched the spinal, watched the doctors put in the spinal. I also watched, him cut her, everything. I watched every single thing. And like, once again, luckily, I got a doctor that was very nice. He thoroughly explained everything to me. Said, hey, Maria, have you ever seen a C-section before? And I told him no. So he was like, all right, get up here, right here. And there was another nurse in there with me. She was the OB tech. For her, she was like, I want you right here, stand here so you can see everything. I want this to be a great experience for you as a student. And it was, because I watched them cut her, and that part I wasn't queasy at, because I'm not queasy, like when you see blood or anything like that. So I was good through that part. So he cut her, and then the part where he took the baby out, I was still okay. I'm still of course there's a lot of stuff in between that, but when he got the baby out, I was like, oh, okay, yeah, I'm still cool. Cut the umbilical cord, I'm still cool, I'm good. They collected the cord blood for personal storage, not like donation, not anything like that, but in case anything happens to the baby or anything to that degree, they put the personal cord blood in there. They stored somewhere at another facility, like not at the hospital, but another facility. So I watched that whole collection, and that was pretty amazing because I've never seen that before anyway. And after that, I was still good. I'm still breathing. I'm still, making sure my knees not not hyperextended or anything like that. Like, I'm like, let me make sure I'm good. So I was fine up until the point where he put that uterus on top of her stomach so he could sew it back up. At that point, I was like, yo, I feel a little queasy. I'm hot. I started to get a little sweaty. I was like, Lord, please, Maria, don't pass out in here. Do not pass out. All this sterile stuff. It's a sterile environment. Please don't pass out. I didn't. So I watched it and everything. And then, every time that I see things like this, like even the first assist, she was amazing too, because she actually helped the doctor do everything, sewed up certain parts. She explained things too, so she was nice too. But you're not always going to get nice nurses. And I realize that. And I hope moving forward that I understand that every day is not always a very great day in the nursing world. I do understand that. But I hope that it is. And I hope that I keep a positive note, because I want to be a positive, nice nurse. Yeah, so the nurse that was in there, she wasn't that nice. So she was like, oh, well, you can leave out now. So yeah, so I ended up leaving out. I needed to anyway, but that was besides the point. I felt queasy, I felt hot, like I was gonna pass out, but I didn't. I held it down. So yeah, so I got out of there and got that fresh air, and I was just really excited that, I had this whole clinical and that this rotation was as fun as it was, as knowledgeable as it was, as refreshing as it was. This whole class has just been like really amazing for me. And I need that sometimes because it's like, sometimes you think like, what the hell am I doing? Like, why do I want to be a nurse? Like, people are hateful and ugly and just mean. But I want to take care of them. I want to actually be that light, that brightness that they see, that to let them know that, hey, although you're sick, I still want to be able to take care of you and help you get better. I know that sounds corny, but that's just how I feel. So, anywho, so I got a 70. I have to do some remediations, so hopefully it will stick to me this time, and I kind of understand it a little bit more moving forward. Take some more notes. So this is also my go-to book. Love this book. I love it. I love it. Love it. So it's the new edition of Saunders. It has everything in here. I mean, so much information that is unbelievable. Of course, it goes by chapters and everything, but man, for your maternity section, your mother-baby section, it just has so much helpful information. It gives you so many rationales for so many different things. I don't think it helped me on the CMS exam, but it helped me in this class. It helped me to understand. It helped me on tests. It helped me just understand things like the emotions that a mother goes through with postpartum blues and things like that. It just helps me to understand people a little better, and it's going to help me understand how to take care of a pregnant woman a little better. Help me understand what to say, what not to say. Help me understand things to look for, like mastitis, what are you looking for? Pulmonary embolism, what are you looking for? Something else I learned too, I never would have thought like about a couple losing their baby. I understand that this is, some complications that could happen. Maria, totally know that. But it's almost like, well, what do you do? And when I took my ATI test, it was like, I saw like some options, and then one that stuck out to me was like, allow them to take pictures and make a box and have all these memories. I was thinking to myself, like, at first it said take pictures, and I'm like, well, why would they want to do that? Of course that was the answer, but still I was like, well, why would you want to do that? And thinking about it, sometimes I had to get out my own head. So thinking about it, I understood it, and I'm like, okay, these are things that you want to make sure that you tell your patients and explain to your patients and step by step. But yeah, so it gives you a lot of rationales for a lot of different things. It tells you how to care for a newborn, which I absolutely love. It's really, really, really thorough. So I do love that. Priority nursing actions, it gives you that stuff. So when you get those test questions and it's like, what is your first priority? Sometimes I'm like, I have no idea. But for this one, it kind of helps you out a little bit. Because there'll be a lot of things. I say that because there's a lot of things that I want to do, and it may not be the first thing that they want you to do, but I'm learning more so what to do now. What should I do, And this always goes with like different things as far as what you should do, medications to prescribe, what's the side effects, what's the adverse effects, what's the contraindications. So, I mean, this book here is my Bible. I absolutely love it. I roll it around with me all the time. Yes, I have a rolling backpack. So I roll it around with me all the time because I just absolutely love the book. It's really good. So it has all the chapters in here, everything you need: pediatrics, endocrine system, maternal, fundamentals. It even has that in here, which I do love. And they have some NCLEX prep questions and stuff like that. So it's really, 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 really helpful. I just wish that it would have helped me get a better grade on that CMS today. But anywho, moving forward, I'll do better. I just guess I gotta learn how to take better, be a better test taker, I guess. But, that's what it is. So right now, also like after you take your CMS exams on ATI, it has like your, what is it called? Likelihood of passing your NCLEX. So, told you guys that this is my last year. I'm at a 62%. So 62% is not as bad, because I mean it could of course be lower. Then it's like, hey, you're gonna kill somebody. But it's 62%, so I got a little bit of time to get that a little bit better. So it's just the probability, just letting you know that where you are and the probability of you passing the NCLEX. Of course I'm gonna study my ass off for it anyway, so it is what it is. I know I'm gonna pass it, because I am definitely going to be a nurse. Definitely a licensed one. But that's also helpful. I like that they put that in there, so that kind of helps you out, let you know where you are. And like I said, since I have a year to go, that it's going to be helpful. And that's going to kind of give me a guideline of like where I'm at and what I should be working on a little bit more. And I do see those things too. Like even with this exam, it gives you the areas that you need to focus on a little bit more. So I didn't want to tell you guys what's one of them, but just kidding. One was like safety. So I gotta work on my safety. Work on it a little bit more, and go from there. So I do have to study. I have to work this weekend. So I have to work this weekend, and I have to study because my final is next Thursday for this class. And although I hate to see it go, I gotta move on. I definitely do. So I'm gonna do that. I'm gonna study really, really hard. I have a review Tuesday, final on Thursday. So I definitely will post another video on Tuesday, let you guys know how my studying is going. And I probably, if I get my grade back on Thursday, which I don't know if I'm gonna get it back on Thursday or not. I don't know if like after my exam it will automatically pop up, because some classes it does and some classes it doesn't. If it pops up on Thursday and it's good, I definitely probably would do like a live video. Or I'll probably just do a regular video. I don't know. I'll probably do a video Thursday too. That's probably what I do. And let you guys know how my final went. Okay? All right. Well, I will see you guys on Tuesday. Bye.